One of the most common walking deviations after knee injury or knee surgery is to walk with a stiff knee. It can be called stiff knee gait. It can also be called quadriceps avoidance gait. In this video, I'm going to tell you exactly why that happens, and I'm also going to show you how to overcome it so you can get back to a nice, smooth walking pattern and decrease the damage that you're doing to your knee joint. So if you've been walking around with a stiff leg, painful knee since your knee surgery or injury, this video is for you. Hey everyone, I'm Dr. Kevin Vandy, physical therapist and gait specialist, here to talk to you about a very common post-knee injury, post-knee surgery walking deviation called quadriceps avoidance. Now, you might not have heard of that, but there may be a chance if you're watching this video that you've experienced it. So let me first describe exactly what that is. So your quadriceps muscles are the muscles in the front of your thigh, as you can see in the picture here. They're responsible for helping you squat, go up and down stairs. They're responsible for extending your leg. And when you walk, they're responsible for the initial weight acceptance onto your leg and the period where your knee bends right after your heel hits the ground. That's called loading response, and it's a very important part of the walking gait cycle. What happens oftentimes when you have knee pain, whether it be arthritis, a meniscus injury, or maybe you've even had surgery, meniscus surgery or a total knee replacement, or even ACL surgery. What often happens when you have knee pain is when you walk, instead of your heel hitting and your knee bending, what ends up happening is your heel hits and your knee doesn't bend and it stays straight as you step through your gait cycle, your walking cycle. Instead of accepting weight on your heel, your knee bends and then extends to push off. So getting your knee to bend is one of the most important parts of getting your walking to feel normal. It takes pressure off your joint, pressure off your meniscus, helps to reduce swelling, and just helps to feel better when you're out walking. So you can walk for exercise, so you go up and down stairs comfortably, and so it feels like you're making progress in your recovery. So again, this is termed quadriceps avoidance, and it's not often talked about, but it's very common to see after knee injury or knee surgery. So if you have quadriceps avoidance, if you have knee pain and you're walking with a stiff knee walking pattern, you probably want to know why it happened. So there are a few reasons that commonly cause this type of walking pattern. Number one is you have swelling in and around your knee joint. So this is your knee joint here, this is the front, this is the back. Inside of your knee joint you can get effusion or swelling, and that can reduce the activation or the ability of your brain to turn on your quadricep muscle. That gets reduced when there's swelling in your knee. So that's number one. After surgery, injury, one of your number one goals is to get rid of the swelling. By doing that, you increase your range of motion and you increase your brain's ability to turn on that muscle. So that's goal number one. Number two, your patella or your kneecap needs to be able to move up and down on your femur, your thigh bone. It needs to be able to slide and glide as you bend and extend your knee. If there's any restriction in the kneecap, any restriction in the tissue around the kneecap, then it's going to be hard to turn on your quad muscle, and it's going to be hard to bend your knee appropriately when you walk. The final one, obvious but worth stating, is if you have pain in your knee. So if you have cartilage issues, if you have knee arthritis, like I said earlier, meniscus, ACL, all that can cause knee pain. And when your knee hurts, you're less likely to want to bend it when you walk, because you'd rather just walk with a stiff leg gait. It helps you walk easier and it usually hurts less. But if you continue to walk that way, that's where you end up with trouble and you end up wearing out your cartilage earlier than you should. So what I'm going to show you in this video is I'm going to show you the best exercises you can do to get out of quadriceps avoidance, to improve your walking gait pattern, to decrease the pain in your knee, improve your range of motion, and make a speedy recovery back to normal function. So let's get into the exercises. The first exercise we're going to do is an exercise to activate your thigh muscle, your quadriceps. This muscle is directly responsible for controlling your walking pattern, particularly when your heel hits the ground and then when you bend your knee. What you need to do is you need to remind your brain how to access this muscle. And when the knee is swollen or the knee is painful, that can be kind of difficult. So what I want to show you here, turning on this muscle, when I squeeze my thigh, you can see the muscle here contract. This is called a quadriceps set, or a quad set. What's happening here is all four of the quadriceps muscles are contracting and extending the knee, or making it straighten out. What a lot of people try to do with this drill is to push the heel down into the table, but that ends up activating my hamstring, this lower leg muscle. It's what we don't want. We want to activate the top muscle. So the best way to think about this is imagine taking your kneecap and try to pull it up your thigh. So don't try to press it down, but instead try to pull it up your thigh. And if you see, when I contract my thigh muscle, my kneecap moves up my thigh bone. That is a good quad contraction. What you want to do with this drill, you can put a little towel under your knee to give you some feedback, but you want to get to the point where you can isolate just your thigh muscle. You want to squeeze and hold for 3 to 5 seconds and relax. Squeeze and hold 3 to 5 seconds and relax. And you want to do that a lot of times to rebuild the brain muscle connection to this tissue. The next exercise we're going to review is called a terminal knee extension. You're going to use a big heavy band like the green one you see here. Now if you don't have what's called a super band, if you don't have one of those, you can double up. Some TheraBands also work well. You're going to attach it to something sturdy like a leg of a couch or a banister, and you're going to back up so there's constant tension within the band. What you're going to do for this drill is you're going to start with your thigh muscle contracted and your leg pressed to full extension. So fully straight. This should be a normal position for you, because if you have quadriceps avoidance, this is how you're walking. Now the key to this drill is you want the majority of your weight on that leg. So it's helpful to make the other foot up on your toes. 90% of the weight should be on your affected leg. What you're going to do is you're slowly going to let your knee bend till about there. And then you're going to squeeze your thigh to pull the band back. And the key is let it come out slowly. This builds the lengthening ability of your thigh muscle, which is exactly how you use that muscle with walking. And you're going to let it go out nice and slow, and then squeeze back. Out and slow, and squeeze back. Now, you may find your leg jerks a little bit as you come down. That's okay. It just shows you need to build that muscle. So you also don't want to let it quickly go out and in, because then you're not using the muscle. The band is just pulling your knee. So again, thigh muscle squeeze tight. Slowly let your knee bend while you're keeping the thigh muscle engaged, and then squeeze back. You want to do a lot of repetitions. So 30 to 40 repetitions, a couple times a day, every day, to build this skill. For this next exercise, we're going to practice walking itself. And the phase we're going to practice is the moment of heel contact to when the front of your foot touches the ground and your knee bends. Just this one part of the motion, because this, what's called loading response, this part of the motion of walking is what you're missing if you're not using your quadriceps muscle. So what you're going to do here is you're going to start with your weight shifted onto the front leg. This is the side that we're working on. So I'm on my left heel. Weight is starting to move onto the heel, and as I transfer my weight, I'm going to allow my knee to bend as the front of my foot touches the ground. So it's hit with the heel, bend. Hit with the heel, and bend. What you're going to find your quad wants to stay really, your leg wants to stay really straight, so you're going to hit and you're going to try to roll onto your leg without bending your knee. This is how you're walking now. What you want to do is hit with the heel and let the knee bend. Hit with the heel, let the knee bend as the front of your foot touches the ground. And as you get used to it, you want to fall forward onto that leg so it learns how to accept the weight with a bent knee. And you can eventually come off the back leg to give yourself a lot of practice doing this drill. You want to do this again, 50 to 100 reps, a lot of times to get the maximum benefit. The next drill is called a Spanish squat. Again, you're going to double up a strong elastic band or use a super band. It's going to go around the back of both of your knees. What you're going to do here is you're actually going to lean, you're going to sit your butt back so that your knees do not cross your toes. Again, normally it's okay for your knees to do that, but in this case, we really want to build your thigh muscles. And so you're going to sit your butt back into a hip hinge, and then you're going to squeeze your thighs and come up to standing. Hip hinge down into a squat. Slowly is the key. Drive up. Slow down and drive up. This builds the strength of your thigh muscles. Now, strength isn't the only piece we need to work on. That's why we did the activation first. We turned on the muscle before we did the strength drill, so your brain knows how to access it. So that sequence is key. For these, 3 sets of 15 would be a great number to start with. The final drill I'm going to show you to help you get rid of quadriceps avoidance in your walking is just a quick lunge. The other piece that research looks at when talking about how to fix this issue is not only do you need to activate the muscle, you need to turn it on, you have to make it stronger, but you also have to use it in the way it's going to be used, which is in a walking type movement, but it also has to improve the speed of contraction, how fast you turn it on. That's what this drill is for. So this is just a quick lunge. So after you've done the other drills, you want to take a small step backwards with the non-affected leg. And then what you want to do is you're going to come down into a small lunge position like this, but you're going to do it with a bit of speed. So unlike the other ones that are done slow, this is the only one that's done fast. And you want to do it so, again, about 80% of the weight is on that front leg. And it's a quick drop and stop. Quick drop and stop. You want to make sure your knee points straight. You want to make sure your weight's on that leg to train your thigh muscle to activate quickly as you walk. Again, repetitions wise, 10 to 15 repetitions, 2 to 3 sets. All right, so to review what we've gone through in this video. Quadriceps avoidance is a condition in which you have knee pain, usually after surgery, where you walk with a stiff knee during the loading part of walking. It's common but often misunderstood. It's caused when you have swelling around the knee joint, pain in the knee joint, or when your kneecap doesn't have the range of motion that it should. Research shows you need to get the muscle active, meaning your brain has to turn it on, you have to get it stronger, and you also have to move quickly in a functional position such as lunging, squatting, or walking. The drills I showed you today are designed to do just that. Activate the quad, strengthen the quad, and practice the walking motion, both slow and fast. Guys, I'd love if you commented below when you try these exercises. Let me know how they go. If these helped you to be able to bend your knee when you walk and reduce your knee pain, that would be awesome. All right, so there you go. There are the drills you can use to stop walking with a stiff knee and return to normal walking and crush your rehab. Hey guys, if you're interested, I've recorded another video all about quadriceps avoidance with a specific case study example. You can see the video right here. And please like, subscribe, hit the notification bell to be reminded when I release additional videos. And until next time, everyone, train smarter and perform better.